Good evening. My name is Alexia Medici, and I'm here to present the atrocities currently at bay in Venezuela. Before I get into that, I would like to first thank you all for being here. The Bill and Melinda Gates Foundation is an esteemed philanthropy that has done such good around the world. It is my hope that you will all learn to understand the current events in Venezuela and decide it be a worthy cause for your foundation. A little about me and my role in this issue. As I mentioned, my name is Alexia, and I'm a public health nurse. I received my BSN RN from the University of Rhode Island and my Master's of Public Health from the University of New England. As a public health nurse, the skills, competencies, and tools are slightly different than nurses in a hospital or other clinical setting. We are responsible for communities, usually battling the same issues or even the same illnesses. Public health nurses look to work with the communities through planning and communications with other public health professionals. This is all in an effort to improve the overall population health. This role will allow for direct medical care to be involved with the overall health of this population. Currently, in Venezuela, hunger, malnutrition, and dehydration are the crippling issues that require our attention. Further, this issue tends to affect children in disproportionate amounts. In fact, hundreds of children have been affected by the hunger and starvation in Venezuela. Children have even died from being malnourished and or dehydrated. Of course, when discussing this issue, the focus is on the children of the country. 29.5% of the population is under the age of 15 years old. Lower economic status also has a significant impact on hunger. In the capital state of Caracas, Venezuela, 11.4% of the children less than 5 years old are suffering from moderate to severe acute malnutrition. By these numbers alone, we can see that there is a well-deserved concern for this country. In comparison to all of Latin America, with an infant malnutrition rate of about 5%, the rate in Venezuela was nearly 9% in 2015. This issue continues today as the fall of the economy has caused major inflation. The collapse of the economy has a major impact on child hunger. Unfortunately, this economic recession has caused 275% inflation and a 10% decrease in the amount of goods produced in the country. Although a country with some of the largest oil reserves in the world, significant drops in oil prices and inadequate policy has left this country in turmoil. Thus, the immediate problem for this country remains clear. Due to the collapse of the economy, hunger and starvation have taken over the country of Venezuela, which has led to the deaths of hundreds of people, including children. The social ecological model is a frame of reference in understanding the complexity of the different factors that affect health promotion within organizations and communities. As a public health nurse, I will be able to provide care and assistance at an interpersonal and organizational level. Interpersonal relationships and organizations are two inner bands of the SCM. However, the work that is done on these inner bands will make its way to the community and policy, thus generating the changes that will help this community. Unfortunately, this community in the state that it is because of economic hardships and poor economic policy. Therefore, child hunger in Venezuela will not change overnight. In fact, my role will provide for a temporary solution for a very large problem plaguing the country as a whole. Perhaps creating solutions to the immediate issues like malnutrition and dehydration will allow for some relief in the country, thus allowing for focus to be turned around to the economy. Child hunger in Venezuela is an issue that spans all levels of the SCM. At the individual level, families are fleeing Venezuela for Colombia. In terms of supportive measures, families understand and fully believe going to Colombia will give their children a better life. Those who have made it cannot work without a permit and therefore have become creative in finding food and shelter for their families. Conversely, families seeking salvation over the border, thinking it will be better for their families, are sadly mistaken. Conditions of the now severely overpopulated Colombia are showing more issues such as child exploitation, diarrhea, skin conditions, and respiratory illnesses. At the interpersonal level, a local bakery makes bread for the citizens of Barrio Sararia and sends it to the citizens for subsidized prices. The citizens line up for hours outside of the bakery every day to buy this bread and thus provide for their families. On the other hand, street gangs have become more prevalent and have turned to violence. Peers and neighbors are turning on one another. At the organizational level, we see help and hindrances as well. The local government offers a free meal to citizens who are in need for those who can come and wait in line. However, the drop in oil prices has led to a break of the economy, and therefore families are losing their jobs and thus their source of income to provide for their families. Further, the community level allows for organizations in the community to come together for the benefit of all. For example, the Evangelical Church in Pietre, which is the largest slum in South America, provided a free cup of soup to more than 200,000 people in one day. However, not all community members seem to be working together. Riots, protests, and looting have been prevalent since the food shortages began. Families are desperate and are robbing stores out of fear of the future. The grocery store shelves become bare, causing even more turmoil in the economy as the supply and demand are completely off the table. Lastly, the policy level of the SEM, which is essentially where the issue began. The Save the Children International is providing safe places for children to play and learn over the border in Colombia, and the inadequate economy is still an issue. Inadequate economic policy has caused Venezuela's economy to essentially collapse, leading to several hundred of families not knowing where to turn. A few evidence-based practices have been implemented across the globe are important to note. The first is the Alliance for Healthier Generations Healthy Out of School Time. This initiative originated in 2011 and looks to support healthy eating and physical activity. This initiative combats both obesity and hunger. It teaches children the healthier option for food and gives them opportunity to have healthier foods. This program has understood the connections between obesity and hunger. Just as obesity can affect children regardless of age, gender, race, or income, so does hunger. By promoting education of proper nutrition, it may allow parents to figure out what the best options are. It is important for these families to understand what is the best option, especially if they don't know where their next meal is coming from. The second is Freedom from Hunger. It is an evidence-based program that has managed to integrate several approaches to health. They train women and children in nutrition by planting and growing their own food. If these families were able to become self-sustaining on their own, it may help to eradicate this incredible hunger plaguing the country. Further, by teaching the women and children, it may ensure a lengthier sustainability for the families. This information is something that can be passed down between generations and thus will allow the once starving families to become more reliant on themselves and one another. This may in turn help the economy as families can trade and sell their crops. Finally, a comprehensive look at many evidence-based interventions in response to a multitude of health issues that affect child and maternal health in Ethiopia, specifically in regard to nutrition. These interventions look to combat undernutrition and micronutrient deficiencies in women and children. Venezuela went from being a prosperous community to a very impoverished nation. Subsequently, all members should have the ability to participate. Interventions that they suggest include women's empowerment, agriculture, food systems, education, employment, social protection, and safety nets. By combining the proposed interventions into one comprehensive program model, it is understood that the program will encompass maternal and child education as well as female empowerment. The evaluation plan looks to address an intervention by planning each step. The improvement of this community's health is reliant on the work that the public health professionals do to change their situation. Organizing the community health data will be another role I will play in the evaluation process. It will be my job to gather the information from the community. Health education is another role that falls under a public health nurse's position. So for health education, my role in the evaluation will be gathering baseline data and the intervention itself. By engaging in this aspect, I will be able to understand the data more during the evaluation process. Potential barriers and challenges I foresee include a lack of participation by the community members, language barriers, lack of cooperation by majority and governmental leaders, and a still threatened economy. Potential solutions I see would be leaders within the community to help increase participation, being, community members. Make sure staff speaks Spanish, bilingual. Incentives for milestones for majority and governmental leaders. In terms of the logic model used, it is comprised of inputs, activities, outputs, outcomes, and overall impact. When reading the logic model, you should be able to put an if-then in between each column and box. In regards to the child hunger in Venezuela, the inputs would be women and children in Venezuela would need funding for education and tools to begin growing their foods, a predetermined curriculum, staffing appropriations for educational aspects, community advocates, and clinically based members, i.e. physicians or nurses. Also a clinic space or an industrial space to conduct workshops and focus groups or interviews with the community. Going through the rest of the logic model, we see that if we hold workshops and educational demonstrations in agriculture and proper garden management, then increased community participation in primary prevention and aiding the replenishment of the country. If there is an education in basic business and economics for the farmers markets and registries of food distributions, then growth in knowledge due to increase of knowledge, which will help to promote economic growth. The outcome of these activities and outputs would involve an increase in number of community members educated in the areas of agriculture, business, and economics. If the public health professionals will be hired on a volunteer basis to lower expense, however, room and board are still needed, then more are allocated to the community. More funds are allocated to the community efforts and interventions. Further, the outcome would be an improved utilization of health care efforts by the victims affected by hunger, malnutrition, and dehydration. If the community meetings are moderated by community members, then the goals will be based on community needs and are discussed between community members. Thus, the goals are more pertinent and attainable. If there is an increase in communication between community members and governmental officials, then links between them are developed and information can be passed easier. And here are the references, and I wanted to thank you all for listening again. It was a pleasure.